This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page, and I'd like to welcome you to another episode of Doc Talks. Doc Talks is a podcast series which is produced by the Knoxville Academy of Medicine by its staff and by its members. Members of the Knoxville Academy of Medicine are featured here to give information to patients about their practice, about things that are of interest currently, things that might be of interest, but mostly things that are of interest to patients so they can become better educated about how they make their medical decisions. And with that, I have Dr. Chris Siano here with me today. Dr. Siano is a physician. He's not only, this is fascinating because he's not only a physician who's a pediatrician, he's not only an emergency room doctor who works at Children's Hospital, but you also have your own practice out in West Knoxville.
Correct.
Which is functional and integrative medicine.
Correct.
In a previous episode of this, which I advise you to look up if you'd like to know about just the general aspects of functional and integrative medicine, we discussed sort of a lot of the general things that you do in your practice.
Yes.
And on this current podcast, we'd like to discuss one therapy which you think is very significant or important part of your practice, and that would be infusion therapy.
Correct.
Can you talk to us about what infusion therapy is and why it is so important?
Sure. So again, just briefly to recap, the goal of integrative and functional medicine is always to sort of bring the body into wellness or bring the body back into balance. We do use a lot of natural supplements. However, there are limitations to how we can give supplements, and most of that limitation comes from our GI tract. So we can only give a certain amount of vitamins, and it's limited by absorption, and there's something called first pass metabolism, which is where the liver kind of takes into play and reduces the bioavailability of some of these substances into the body. One of those, for example, is vitamin C, which is very useful for immunity or cancer supportive therapy and things of that nature. By doing infusion therapy, we place a small catheter into the vein, and we give intravenous vitamin C or different types of therapies, and that bypasses the gut, which allows us to do a couple things. First, it allows us to avoid that first pass metabolism, so the nutrient concentration gradient is much, much higher. The actual amount of the substance making it into the blood is much higher, and it also allows us to give a much higher concentration of certain things. So for example, again, vitamin C for cancer therapy can sometimes be up to 50 or 75 grams, where you're only taking sometimes by mouth 1,000 milligrams. So that's a great magnitude and difference, and we're only able to accomplish that through using intravenous therapy.
So let's say I'm someone who takes large doses of vitamin C. Intrinsically, when I take all that vitamin C, I'm not really absorbing all that vitamin C. A lot of it's just passing out.
That's correct.
A lot of it's just, I'm not absorbing most of it. And your therapy avoids all of that.
Yes.
By basically using infusions.
That's correct.
So you mentioned vitamin C. Is vitamin C in cancer therapies? Any other sort of illnesses or disorders which would be effectively treated by this?
Sure. We do have a whole host of several different, or a whole menu rather, of several different IV infusion therapies that we offer, and I'll just mention a few of them briefly.
Okay.
One of our more popular ones is a Myers cocktail. Myers cocktail is a very old sort of combination.
So this is not like a cocktail, right?
No, this is a vitamin C cocktail. Not that cocktails aren't good for you, but this type of cocktail is good for you. It's very good for just general well-being, general health. Again, most of our patients who come see us, some of them have gut disorders, or they'll have even things like ulcerative colitis or Crohn's, where their gut absorption is truly impaired. So just giving them a multivitamin really isn't that helpful for them, but giving them vitamins such as a cocktail or a multivitamin through their IV is very helpful. And Myers cocktail is something like that.
Got you. So this would be something that if I were to have some sort of, you mentioned several GI disorders, including, you mentioned earlier about, inflammatory bowel disease, irritable bowel diseases. We talked about celiac earlier.
Yes.
Would this be something that would be good for anybody who has any form of digestive problems?
Yes, anybody who has any forms of digestive problems, or sometimes people who just need a boost. It's very good. It gives you a little bit of an energy boost. It makes you feel well, helps with hydration. It's good for really a lot of things.
So let's say I'm a patient and I come in there for an infusion. How long would I expect to be coming into your office for? What about, a lot of people don't like needles. Are these large needles or small needles?
Sure,
Yeah.
sure. So one of the things that makes our office different is we're never in a rush. Our first patient visits are 45 minutes to 60 minutes long. So we're not the sort of, physician practices where you just have 10 minutes with the doctor, where the doctor comes in and puts their timer on the table and then walks out in 10 minutes. You have quite a fair amount of time with us. You have a fair amount of access to us compared to other medical practices. But specifically for infusion therapies, you can be there from anywhere from 1 to 3 hours. You're greeted, you have a small visit, your vitals are taken. We do have to use a needle. It's not a very large needle. We use the smallest that we can, and it's inserted, peripherally, just in an arm vein. Usually your elbow or your hand, and then we run those infusions mostly about an hour or so is probably most common. However, sometimes we slow them down or speed them up to patient comfort.
Gotcha. So this is not just a one-stop shop. You're not just coming in there and you're saying, okay, you need this, and I'm going to give you this infusion. It's truly personalized. It truly is designed for these patients. Individualized therapies based upon individual diseases and the patient, and what essentially the patient would want.
Yes, that is correct. We do not provide just infusion therapy. In fact, all of our infusion services have to be for our patients. So you have to have a medical visit, because that's truly, again, when you're practicing the type of medicine that we're practicing and you want to do it correctly, it shouldn't just be come in and get your vitamin C. It should be, well, come in, let's do our full history and physical, find out what's wrong with you, find out what else we can correct, and then as part of that therapy and part of that process, infusions play a large role.
Well, let's say I'm a patient who's already on a form of medication. I'm already seeing another doctor, I've got a gastroenterologist, and I'm seeing someone, but I'm not necessarily satisfied with the results. Would I have to stop taking my medication when I come to see you, or would I have to, basically just stop all things together and then say, okay, well, I'm going to start anew with you and be treated, as your patient?
That's a great question. So we work hand in hand with a lot of primary care physicians, specifically with a lot of GI doctors, because GI specialties, especially in the pediatric populations, for something called functional abdominal pain, where they've had scopes, top and bottom, and they've had multiple scans, but no one finds anything wrong, but yet you still have a child or a patient who has chronic abdominal pain, chronic diarrhea, and they've been on lots of medications from their GI doctors. They come to us, and the medications and supplements that we provide and different types of services like infusion services usually are complementary.
So, and you mentioned children. So you treat people of any age group. You are a pediatrician by trade, but you treat people. You treat small children all the way up to
yes.
Yes. Old people. So.
Yes. Mm-hmm.
Old people like me.
Okay.
So.
Yes, we treat any age group.
But so excellent. Well, so we talked about 2 of the cocktails or 2 of the infusion therapies that you provide, and you mentioned there was a third.
Yes. Yeah, we actually have a whole host. So
well, there were 3 that you wanted to touch on. So
yeah.
Sure.
So Myers is one. That's sort of just like a multivitamin cocktail. Vitamin C is pure vitamin C and what we call high dose vitamin C we use for cancer therapies. But we do have others. One of the other ones that I think is important to highlight is something called phosphatidylcholine with glutathione. So glutathione is our liver's probably our most powerful antioxidant in the body, and we can supplement that IV. So you can imagine that is good for anything where processes that you need detox, like mold or Lyme, or you need to detox some chemicals. And the PTC portion of it, so we have cells in our body, and each cell is surrounded by a membrane, and that membrane is composed of phospholipids. Mm-hmm. And each phospholipid, the most common one in the body is phosphatidylcholine. So the thought process behind that is we are giving your body these two substances, glutathione to help you detox and take away the bad cell components, and then we're giving your body brand new phospholipids to hopefully encourage it to take the new phospholipid and incorporate that into the cellular membrane. And you can imagine that is a type of healing that occurs at a cellular level. So it's very
So
profound.
basically helping the body heal itself naturally, but
Yes.
sort of accelerating the response a little bit.
Yes.
And out of these therapies you've mentioned, these aren't any kind of special different drugs. I don't need a prescription to take these. I mean, these are naturally occurring things that I typically could be able to get elsewhere, but you deliver them in a different method.
That's correct, yeah. So phosphatidylcholine and glutathione, for example, you can take. There's liposomal, over-the-counter supplements and stuff, but the difference between the intravenous therapy and the oral therapy is profound.
Gotcha.
Yeah.
So I want to take a minute to talk about, is there any other forms of infusion therapy that you offer that you'd like to talk about, or any other diseases that or disorders that patients might be interested in that they might have, that they could come to you for perhaps additional therapy or better therapies for what they have now?
One last therapy that I'd like to mention is something called IV ozone therapy. So we are the only practice who has that in Knoxville right now, and that is a particular type of therapy that works on a cycle in our body called the Krebs cycle, and it works specifically through an enzyme called NAD. And anything that helps increase that enzyme in our body is healthy for almost any tissue in any disorder. So it's a very unique therapy because there's sort of not one disease or disorder or ailment or symptom that one person could have that it wouldn't help. But it's particularly useful in patients who have Lyme disease or who have mold concerns or who have some toxicity concerns. It's also useful for cancer therapy. It's one of those things that just helps the body do what it's supposed to do and heal itself.
And I wouldn't even necessarily have to be sick to come in for any of these therapies. I mean, these therapies would be good and beneficial regardless of my general overall state of health.
Most of them, yes. Most of them, yes. For sure, the IV, the Myers cocktail and the ozone therapy and things like PTC and glutathione and things of that nature, we direct if you need them.
Gotcha. So, well, we had talked about this earlier, but I'd like you to talk about it again. Now, your office is out in West Knoxville.
Correct.
It's in a very unique location you
Yes.
talked about. Could you tell us a little bit about that?
Yes, it's in the historic Cheryl Walker House, which is on the historic registry. It's a pre-Civil War home. It's passed through multiple generations. It's right out in front of Academy Sports and across the street from Home Depot. It's been fully restored, which is really neat because there was a physician practicing there at one time, and he used to live there and see his patients there. And we enjoy that building, which has lots of its original architecture, original brick, original mortar, original flooring. It's just a neat, fascinating building to
So if I come in there as a patient and I'm getting an infusion therapy and I'm sitting there for an hour and I'm not sitting in like some clinic with a metal chair and people running around, what's the environment like?
Absolutely not. Actually, so when you walk in, it's like you're walking into the foyer of a house. You see a big stairwell. You have a nice sort of a light fixture. Our infusion room, actually, there's a flat screen TV on the wall. You sit in recliners. We don't really have traditional medical beds. We do have medical, tables for exams, but everything else other than that, unless you're having some sort of minor procedure or anything like that, is very non-traditional. Lots of repurposed furniture, lots of things that have been recycled. It's got a really neat vibe when you walk in.
So a very comforting vibe, not so much so, which sort of goes along with your entire therapeutic, the way that you approach your therapies. I guess it's just sort of a general whole approach that you're taking, that you're generally taking a non-traditional approach.
Yes.
And trying, to use other methods to basically help patients, help their overall, their health, and basically help them get better if they have any disorders.
Yes, we truly, just like the house has been restored, we truly bring that motto into helping our patients. We want to restore your health and help your body restore your health, and do that as naturally as possible using integrative and functional medicine.
Now, but you couldn't help any patients who were actually as old as the house, right? Because that's
Not yet. One day.
Well, Dr. Chris, thank you so much for joining me here today. I would like for you to give us the information about, you mentioned where it is. Can you give us the address?
Sure.
And maybe your phone number, and this will appear on the bottom of the screen for people who are watching this.
Sure.
And a website if we're interested in getting any additional information before we see you.
Yes. Our address is 9320 Kingston Pike, and that's, again, right in front of Academy Sports and right across the street from Home Depot. Our website address is www.knoxwellnessexperience.com. However, if you just put in Knox Wellness, usually will pop up, the first one on Google, but it's knoxwellnessexperience.com. And our telephone number is 865-801-9501.
Excellent. Dr. Chris, I know you've given me a lot of good information here today, stuff that I didn't know much about, and I hope that it gives us, well, I know it's going to give good information to patients who are seeking to try and better their health through maybe not traditional methods, through basically symptomatic methods, through basically preventing and making themselves better through using therapies like you offer.
Thank you.
And with that, that concludes this episode of Doc Talks. Doc Talks is a podcast that's produced by the Knoxville Academy of Medicine. It's produced by the staff and with the members for patients to provide them information about additional types of medicine or good information about topical issues to help them aid in their medical decisions. And with that, I would like to thank you for joining us, and you have a wonderful day. Thank you.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.